As we've touched on already, complications from hypertension, probably the biggest concern is stroke or cerebral vascular accident. We'll cover stroke in more detail in a particular lecture, but stroke is basically a heart attack in the brain. So you can have blockages just like you have in the heart, in the brain, or a person can have a bleeding in the brain. They can have what's called a hemorrhagic stroke. So both of these are very serious and obviously result in lots of disability. Hypertension can lead to heart attack. We talked about hypertension's role in the injury to the endothelium and in the atherosclerotic process. With kidney disease, as we'll find out when we have our class, particularly on kidney disease, most of the patients in the dialysis clinic have either hypertension and or diabetes, so one or the other or both. So that is a real concern. The high blood pressure really damages the nephrons in the kidney. So kidney disease is a result of that. We talked about heart failure. So the heart is trying to pump all this blood. The heart enlarges as a result of that. Systemic vascular resistance. So again, there's a vasoconstriction, particularly as a result of people who develop arteriosclerosis. So they can have an impaired circulation to organs, to extremities. So that is something to really be concerned about, because if people have poor circulation, they could be risk of diseases or amputations as a result of poor circulation, which might have resulted from hypertension. Treatments for hypertension. We'll talk about medications on the next slide, but there are many things that people can do to lower their blood pressure. Lifestyle treatments, especially for pre-hypertension and maybe mild stage 1. So that is the first line of defense, and these are things that people can do. Weight loss, even a small amount of weight loss, so 5 to 10%. So if we're looking at someone who's 200 pounds, if they lose 10 to 20 pounds, they will see a dramatic improvement in their blood pressure. And I think it goes without saying that smoking cessation needs to be part of that. Regular exercise. Exercise is great, especially for people with pre-hypertension. Dietary changes. We'll talk about the links. Look at the links on Blackboard for sodium guidelines. 1,500 milligrams per day. If you're an adult over 50, if you are a person with chronic diseases, or if you are an African American of any age, you should be targeting 1,500 milligrams per day. Now, if you just look at any food labels that you may have on hand, 1,500 milligrams is pretty challenging to do. So if you go out to a restaurant meal, you could get 1,500 milligrams in one meal. Even something that you think is a healthy lunch, like Panera. If you go to Panera and you get a Panera soup, a cup of soup has 1,000 milligrams of sodium in it. So it is really challenging for people who have to watch their sodium to do so. Now, one of the ways that you can get low sodium is to increase your potassium, magnesium, and calcium through a diet that is high in fruits and vegetables. And we'll talk a lot in class about the DASH diet, and I've got the links on Blackboard. So, the DASH diet is very, very high in fruits and vegetables. In the general sense, people whose diets are high in fruits and vegetables are going to be much lower in processed foods. And vice versa. People whose diets are very high in processed foods be high in sodium, and they're going to be very low in fruits and vegetables. So you can see that it is high amounts of fruits and vegetables, but that can be very expensive for a lot of people to get the recommended 5 to 9 fruit and vegetable servings a day. So it's doable, but it's challenging. But we'll do some programming with the DASH diet and some case studies with hypertension.